All right. Hello, everyone. Thank you for watching this webinar recording. My name is Kristen Richmond. I am the Volunteer Engagement Manager with 365 Health. So today I am joined by Leslie, who is our Business Development Manager with 365 Health. We're going to go through information on our new telehealth service, Health in Hand. Really hoping to provide good information for you all. That way, if you feel it's a right fit for your community, for your health fair, and for your team, you can reach out and learn more in this webinar and then reach out to us for more information. So we'll go ahead and get started. Wonderful. So Health in Hand, it's a really amazing service, and we really see it as a huge value point for potential health fair participants. And there's definitely, more benefits outside of just our participants as well. But we're really working to show you the potential benefits that bringing the service to your health fair can provide for really just a robust experience and interactions with participants at your health fair. So I will give it over to Leslie to tell you a little bit more about this great service.
Thank you, Kristen. I'm excited to be here and share information with folks as you all are getting prepared and getting the things wrapped up to launch your health fairs. So similar to the people that you're trying to reach at your health fair, these are the same folks that we're trying to reach with the Health in Hand service. So you don't, just like with all of 365 Health's resources, you do not need to have documentation in order to be a member of Health in Hand. We're really trying to reach this population because it was very exciting in Colorado. For the first time, people without documentation could purchase an insurance plan through the OmniSalud program that is specific to Colorado. However, that is a pretty expensive health insurance service. There's some people who received a Silver Enhanced plan, which was subsidized similar to Medicaid, but many more people will remain without insurance. And so this is a great population for us to reach for the Health in Hand service. There are a lot of other people in Colorado who are uninsured and underinsured. And so when I say underinsured, that absolutely has to do with finances, but it can also have to do with language barriers or transportation barriers or people who might not have time off to get the medical care that they need when clinics are open. Some of the reasons why people might not have insurance is they were eligible to get insurance through the exchange, but they missed the open enrollment period. There's also, with the end of the public health emergency, there will be people who are no longer eligible for Medicaid. And there are a lot of efforts underway to get them signed up for insurance through the exchange or through their employer, but that will not be the solution for everyone. And so some folks at the end of the public health emergency will not have insurance. And then there are people who may not be able to afford the monthly premium through an insurance plan through the exchange or their employer, or they might not be able to afford the medical care if they can afford the monthly premium. So it's also really important to note that it doesn't matter if you have insurance or not to be eligible for the Health in Hand service. Someone who has Medicaid or Medicare, their child is enrolled in the CHIP Plus program, or maybe it's someone who has a high deductible plan through their employer or through the exchange. These are all people who this would be a very complimentary service for them to increase their access to medical care and to reduce some of their out-of-pocket medical expenses. So let's dive in. There are 3 different elements of the Health in Hand service. So first is text first on-demand telehealth. We're going to go over what that is. And this gives folks access to licensed physicians any time of the day, any time of the year. They also can opt to include the basic blood chemistry screening. You all are very familiar with that. This is a really affordable way to get that blood chemistry screening when you bundle it with the on-demand telehealth. And then just as 365 Health has always done, we provide our members with monthly emails, and they have access to all of the rich health education information on the 365 Health website. So, realizing that I forgot to take out this slide, when we're doing a live presentation, we do talk to people about what their experience is with telehealth. And the reason why I asked that question is because a lot of people had exposure to telehealth during COVID. So they made appointments with their doctor, with their nurse practitioner, with their therapist. They found a quiet space for a phone or a video call, and people loved how much flexibility it gave them to get the medical care that they need. But that is very different from on-demand telehealth. So I'm going to go to the next slide. You're going to see a really cool interactive graphic. So I'm going to be quiet for a moment so you can see what a texting exchange looks like when you do on-demand telehealth. Great. All right. So hopefully that gave you an idea of what on-demand telehealth can look like. It's a live doctor. You can upload photos. You can upload your screening results from your health fair results. So it really is a great way to get connected to a doctor. And so here's just a little bit more information about why we think that access to on-demand telehealth is such a good option for your health fair participants. So this is something that is extremely affordable. We'll go over price in a little bit. People never have to pay a copay. You can use the service as often as you want. You can go back to the doctor with more and more questions, and you never have to worry about a copay. The doctors are able to write prescriptions. The cost of those prescriptions is not covered in the service, but we are working on a prescription card that helps people get at least a reduced rate for those prescriptions when they go to the pharmacy. It is extremely accessible, not just for English speakers, but also for people whose native language is anything but English. So for our Spanish speakers, they can do texting with live translation. And then the service that we use for telehealth, they have access to interpreters who are trained in medical interpretation for over 250 languages. We know that this is a huge issue for folks because people have a fear that what they're saying to the doctor and what they're hearing from the doctor, that there's a high risk for misinterpretation of information. So being able to communicate in your native language is a really big barrier that we wanted to be able to address. So people can start with texting, then they can elevate to phone or video calls. And that is definitely the way that people who need those medical interpreters, that's how they connect with the doctors. But you have the ability to communicate in those three ways. As I've mentioned, it's unlimited access. And no matter where you are in the United States, you have access to that telehealth service. It's not just for when you're in Colorado. Like you can do with your primary care provider, you can create care plans with your doctor. So if you have diabetes, if you're suffering from insomnia, if you have a rash, you have poison ivy, the doctor can create a care plan for you that may or may not include medications. You have the ability to customize your profile. You can put in your preferred language, your pronouns, your medical history, so the doctor has that information easily available to them so they can provide that personalized care. And a really fascinating feature is that you can do follow-up calls with the doctor. So you're talking to a doctor about insomnia that you're experiencing. The doctor prescribes some medication, and you can schedule a follow-up call so the doctor will reach out to you through the app so that you can have some continuous care with that specific doctor. So what can you use telehealth for? So here's a variety of medical conditions that the telehealth doctors are able to provide treatment for. So I do want to make a really important note that the mental health is only available to adults. Adults and children can access women's health care, chronic disease management, and acute care. So it's just the mental health because of privacy laws, and they vary in so many different states that piece is just available to adults. So for the most part, the telehealth doctors can provide the care that you need. In some situations, they do need to refer you for in-person care. And this is another fantastic aspect of the telehealth service. They can do triage. Everybody wants to keep people out of the emergency room if they don't need to go. And so the doctors can let the patient know, do you need to go to the emergency room? Can you go to an urgent care center if that's available in your community, or can you wait and get an appointment with your community health center or with your nurse practitioner physician if you have a medical home and if you have insurance? If you do not, the doctor will send you over to our resource locator page. You put in your zip code, and that is the way that you can find free and affordable care in your community. So we want to make sure that when someone needs in-person care, they can still reduce their out-of-pocket cost as much as possible. Okay. So blood screenings, again, you all are really familiar with this. When you get the Health Enhanced service with the blood screening for adults, people now have the option of either doing that blood screening at a health fair or at one of the Quest patient service centers. So we're really excited that now people have multiple options to complete their blood screening. The know-how is the health information that I mentioned that we have available. So there's videos and assessments, and again, those monthly emails. Those emails are great because they include sample questions that people can ask the telehealth doctors. And sometimes that prompt is what people need to open up the app and start using the telehealth service. So we really see these three pieces coming together to really provide comprehensive care for the individual. So ideally, they would get their blood screening done. They can upload the blood screening results to the telehealth app, and they can talk to the doctor about things that may be of concern with their blood screening results. And then as they work with the doctor to create their care plan, they have access to all of those assessments and recipes and things like that to help them move along in their journey to better health. Okay, let's talk about cost. So there are two different options for Health in Hand. For those folks who want to include the blood screening, it's $99 a year. If they either are purchasing this once they've gotten to the health fair, they've pre-registered, they've already paid for their blood screening, they can choose to get the plan for $80 a year, and that's really the telehealth portion. So you can see by bundling the telehealth and the blood screening, it is a great savings for people. So advertising that $99 rate prior to your health fair is really, really important. And you have access to all kinds of flyers. The publicity success packet has some information. We can send you some other flyers that promote the $99 or $80 options. And then you also have access to social media posts and email templates. If you need some help talking through them, we are available to support you to see what would be the best to send out to your community. And like everything, all of this information is available in English and Spanish. So let's talk about partnership opportunities. So it's really important to note that we do have some grants where we can provide free memberships. So if you have a fair that is taking place in Adams County, or you will be attracting people from Adams County, we can sign them up for free memberships. Most of the fairs that are around Adams County, Health in Hand staff are already planning to be there so they can register people, and those staff are English and Spanish speakers. We have another grant for folks who live in any kind of supportive housing. So folks who have Section 8 vouchers, maybe they're in a facility that's providing wraparound services to really help moms get back into the workforce. That kind of housing, we can also be at fairs and sign those folks up for free memberships. And then really broadly, immigrant community members. So if you are connecting with a partner, and they will be sending over people from their organization who are immigrants. Please, please let us know. We would love to be at your health fair to get those folks signed up for Health in Hand. And we would work with you to do the pre-health fair promotion to make sure that it's a good use of our time to be there and get those folks signed up, especially if you're outside of the Denver metro area. And then we're always looking for new grant opportunities because we know that $99 can be really affordable for some, but it is out of reach for others. And we don't want that to be something that prevents people from getting this service. If you are interested in having volunteers trained to talk to people about Health in Hand and get them registered, we can support you with that. So we can get you trained. We also have videos in English and Spanish that walk people through the registration process. And we have registration guides with screenshots, again in English and Spanish, that go through the registration process. As I've mentioned, we can attend events. So, please reach out. Let's talk about who you're expecting to attend your health fair. How can we help you with promotion of your health fair? And again, it depends on the location and the number of participants and the kinds of participants that you're expecting. That all comes into play as we decide whether or not Health in Hand staff will be there to help folks sign up and learn about the service. All right, and then lastly, contact information. So here's my email address. My counterpart, Jennifer, is also available for support. Her contact information is there as well. Please don't hesitate to reach out to us. We'd love to chat with you about how we can work together to bring this service to your community members. Thank you.